Hello everyone and welcome back to my channel. Myself Dr. Surbisani. Hope you are doing great. Now today I come forward to talk about the third topic, which is very important: oral pathology, that is the developmental disturbances in the shape of the teeth. That is very important because most of the question come from this topic and many of the students got confused. So we will take this topic bit slow and definitely in detail, so that will help you a lot to go through and understand the topic very well. Don't forget to watch this video till the end. Hit the like button if you like this video and at least subscribe to my channel if you are new on my channel. Now back to the topic. Let's start with the developmental disturbances, that too in the shape of the teeth. There are basically the 9 conditions that are come under the developmental disturbances, that too in the shape of the teeth. So to understand this, we need to know there are 9 conditions name. The first one is the gemination, second fusion, third concrescence, fourth dilaceration, fifth talus cusp, sixth taurodontism, seventh dense invaginatus, 8th dense evaginatus, and the 9th one is the supernumerary teeth. Start with the first topic, that is the gemination. Gemination means to arrange in pairs or to double. That means this condition occur at an attempt when there is a division in the formation of a tooth, that is by the invagination, which will result which will result in the incomplete formation of the two teeth, right? Usually we have a completed two crowns or the incompleted two separate crowns, but there is only one single root and one single root canal is there. कि इनकम्प्लीटली फॉर्म भी होंगे, कंप्लीटली फॉर्म भी हो सकते हैं, लेकिन उनकी रूट और रूट कैनाल की बात करें तो दैट इज ओनली वन, right? It is seen in the deciduous dentition as well as it is seen in the permanent dentition. If we came to know about the cause or the reason is heredity. The question is, what are the teeth involved in case of the gemination? Usually the maxillary incisors are involved in case of the gemination. And if we see there is any clinical complication, if there is a gemination in a jaw, definitely there is a periodontal problem might be there, and those type of the teeth which are the gemination teeth, those type of the teeth are more prone to the dental caries. Their complication, if we see in case of the gemination in the tooth, the first clinical complication is that they are more susceptible to the caries, dental caries. Second one is the periodontal problem is there. Third, the malocclusion is affected. Fourth, they are having more tendency to have a pulpal infection. Followed by the second condition